am a people person and a people pleaser. My name is Brittany Metz. I am a lead patient care technician at HCA Florida Capitol Hospital. We do the direct hands-on care under a registered nurse where we'll do toileting, turning, bathing, the more assisting of daily living tasks that most patients, geriatric patients, can't do at home. Walk into the bathroom, maybe putting on their clothes, simple things that we might be able to do that they can't. I got in the PCT role because when I was a kid, I've always wanted to be in healthcare. I just wasn't sure what I was going to do. I remember my mom passed away, and I remember the nurses and everybody working on her, and I knew, I was like, I want to be that. I want to do that. Originally, I started as a home health aide working for a local company, and eventually I was like, I'm gonna go to school to try and get this done. Went to Lively and got the patient care technician, and I applied to Capitol. For the PCT's course training through school, I went to a program that took about maybe 10 months, and they'll teach you all the aspects, hands-on, charting, all this. We do clinicals, all of that in about 10 months, and within 3 months you probably would get a job somewhere. There's a high demand for PCTs. My next goal is to go to nursing school, become an RN, and eventually go for my APRN. I like to consider myself a great PCT because I always put my patient first, and I like to think of them as how I would want to be treated if I was being taken care of. I recommend maybe like a biology or anatomy courses mainly because that'll help you get familiar. I know because of those courses I actually had even more interest in it. I want to know what the body was like. I wanted to know, the body of science, And then out of high school, go straight into college and do the same thing. I was a camp counselor for a GA camp. Even though it was little kids, I just love the fact that I could help them because we got a lot of homesick kids. They were away from home, so they were missing their home and they were wanting to go home, whereas we get patients here who are just ready to leave. They want to get better and they want to leave. I feel like part of my job is to reassure them that, hey, we're going to get you taken care of and then you can leave. We don't want you to go home and have to come right back. There's a very diverse communication aspect when it comes to family, to colleagues, to patients. It's mainly just trying to figure out which method you're going to use when you get to them, because you don't want to come off as a very strong personality to somebody who's very vulnerable. But most of the time I try and keep my patients informed best in my scope, because I don't want to keep them out of the loop when they deserve to know. When I'm working with colleagues, I try to inform them, hey, such and such vital signs are this much and they want to do this, hey, they need this. And with family members, I'll direct them to the nurse if it's something that I cannot answer myself. The highlight of my career, I know this is going to sound really unscripted, but is working at Capitol. Honestly, it was one of the best jobs I've ever worked at. I learned a lot of things here. There's a big opportunity to grow here, and I feel like the past 3 years have been the highlight because I have learned so much, interacted with some great people, have seen so much and learned so much just by being even more hands-on than I was able to be at the other places. Hearing patients thank me specifically for what I've done, not for all that I've done. Walking them in the hallway, getting them dressed, washing their back. It's the simple things, or my nurses, or even our CNO coming up, say, hey, Brittany, see him in the hallway, and don't just see me as a staff member, but sees me as a person. So it gets me going, mainly because I get to be something and make a difference. The main thing I want to say if you want to enter this field is, if you want to be in this field, do your research first, because you don't want to come in this field and figure out this is not what's for me and it's too late. You don't want to put yourself in a position where you're going to hate it, because this job, you can really love it. You can make the best of it if you really love it.